They knew they should get care, but they did not want to risk their bank account or maybe even their home in the effort to find out. So they would wait sometimes months and then have a crisis that would force them to the emergency room. Their family would bring them in and they would find out that they had advanced cancer. Each time that happened, it was like being socked in the gut. Right now, we're giving our money to private insurance companies, private equity companies, which we have no control over, and they're telling us what healthcare we can have and what we can't have. So I'm urging people to realize government is us if we make it be.
Hello, everyone, and welcome to Your Health Care, the series where we talk about healthcare in the United States and the need for affordable universal healthcare for everyone. Today, my guest is Dr. Mike Huntington. Thanks for being here.
You're welcome. Nice to be here.
Now, you were the medical director at the Samaritan Regional Cancer Center in Corvallis.
That's correct.
Between 1984 and 2006.
Yes.
And after you retired, you are now, let's see if I can get this right. So you are the vice chair of Mid-Valley Healthcare Advocates, which is fighting for universal health care for all Oregonians. You are the treasurer for Physicians for a National Health Program, Oregon, which is a group of doctors, but more than just doctors, but also fighting for universal health care, and the secretary for One Payer States, which is a national organization fighting to win universal health care through the states with the eventual goal of winning universal health care for everyone in the country.
That's correct.
First question I have to ask, are you more busy now or when you were still working?
Yeah, it's just about the same. The stress is a little bit less, of course, because I don't have the daily worry about patients, but I do have the daily worry about our healthcare system. And that takes a lot of time and a lot of research and a lot of communication to correct that problem.
We're talking about universal health care, which means the first question I want to ask is, when you hear the words universal health care, what does that mean to you?
It means to me that every person in this country, resident of this country, can get to health care without facing unaffordable costs. Good health care that's affordable to the patients and their families.
So what do you think is the number one reason that we need universal health care in this country?
So I would see patients sometimes that had avoided coming in for care, maybe even months. And you can guess why they didn't come in. They were so afraid of what it might cost that even though they knew they had something pretty serious, they didn't know what it was yet, but they had weight loss or pain or other symptoms, and they knew they should get care, but they did not want to risk their bank account or maybe even their home in the effort to find out. So they would wait sometimes months and then have a crisis that would force them to the emergency room. Their family would bring them in and they would find out that they had advanced cancer. Each time that happened, it was like being socked in the gut, not just for the family and the patient, but for those of us trying to take care of people. That's what made me start to realize this is not right. This doesn't have to happen. And then I learned that other countries did not punish their people for getting sick or injured. And I found out how they did that. So I've been in the last 20 years helping our country to find a way to not punish our people for getting sick or injured.
And you worked there you were director for 22 years, and maybe, did you work there longer than that?
No, I had worked in other centers for another 15 years or so before I came to Corvallis.
And how often did you see that kind of thing happening that you describe?
I wasn't aware of it until maybe the last 5 years of my career. And that's at a time when treatments were becoming much more expensive, and it was much harder to get care without risking your bank account. So that's when I realized it's a serious problem. It had been developing all those years. I just wasn't aware of it.
So when was the point that you think it really started, like you started really noticing uptick in the in that problem?
Well, there might have been a key case, for example, this was a conversation that our nurse heard in one of the exam rooms. A middle-aged couple, and the gentleman was saying, "Honey, they say it's stage 3 lung cancer, and then I need chemotherapy and radiation therapy. There's no guarantee that's going to work. I don't want to leave you and the kids without savings or a home." That's when it came to me that this was happening not just in our cancer center, but most likely everywhere. And my research confirmed that this is a common concern that patients and their families were having to deal with. So I thought it was time to get busy,
Yeah.
do something about it.
In your time doing this work, have you met other doctors that have sort of a story similar to yours?
Yes. Frequently, I will hear complaints from doctors that they know what the patient needs, and yet the company they work for, the clinic or the hospital, has, or the insurance company, tells them, no, you will not gain prior authorization because it doesn't fit our guidelines. Well, the guidelines may or may not be in the best interest of the patient, and more likely are in the best interest of the financial concern for that company.
So it sounds like, as you described, this is a very widespread problem. I mean, like, physicians are seeing this, and obviously the American people are seeing this as well. But we still don't have universal health care. So clearly there is a lot of resistance to getting that and getting affordable care. Where would you say that resistance comes from?
Well, first of all, a resistance to change is always there. If you are used to something, you've heard the old adage that the devil you know may be better than the one you don't know, and you don't want to take a risk. So that's number one. Another is that many people are insulated from the pain of inflicted by our healthcare system. If they've not been ill, if they've always had good health insurance, they may not fully realize what it's like for about a third of our people who may be working jobs, maybe 2 jobs, but still can't afford health care. But they may be making too much to qualify for Medicaid because their income is just a bit too high. And so that is extremely unfair. And that is something we have to make sure people understand, that just because this hasn't happened to you yet, tomorrow you could get a phone call about a family member or yourself having a diagnosis that may lead to hundreds of thousands of dollars of cost. Are you prepared for that? My understanding is that not many Americans are even ready to handle an unexpected $400 debt. Those are reasons that we hope will make sense. Now, with healthcare being cut back by our current administration, and healthcare insurance premiums doubling and tripling, more people are aware and may be willing to think about a solution not run by the government, unless you realize you are government. If you take a role in government, and if we all do, we can provide health care. We will be willing to pay the taxes. We will not say it's that government is going to provide it for me. It's us. And here's how we're going to do it in a way that's equitable and efficient and simple.
So I want to actually focus in on what you just said. So, like, healthcare not provided by the government. Are you saying, like, provided by the people? Like, what you're saying is framing it not, think about it not in terms of the government giving us healthcare, us giving ourselves healthcare
Yes.
with our tax dollars.
Yes.
Right?
Yeah. So people are worried about taxes and what is government when they're thinking of it as some other entity. How's it going to use my taxes? I think I know how to use a tax refund better than the government knows how to use my taxes. And the answer there is, think of it as the investment that your parents and grandparents made in interstate highways, bridges, scientific research on medication, immunizations. All of that was invested by them. They did call it taxes for our benefit. And what are we going to do to invest in our children's future and their children's future? You may still call it taxes, but it's really an investment. Now, are we going to use that investment wisely? Only if we're involved. If we go to Salem, if we go to Washington, D.C., and make sure that they are using this money for what we intended, yes. But boy, right now, we're giving our money to private insurance companies, private equity companies, which we have no control over, and they're telling us what healthcare we can have and what we can't have. So I'm urging people to realize government is us if we make it be. And we can create a good, simple system that provides care at a lower cost than what we're paying now.
And actually, as you mentioned, when you're talking about, the highway project, building the national highways, I mean, back when people think about, you could have a family living together in a home. This obviously didn't apply to everyone. But, you could do the idea of someone, one breadwinner making enough money to have a house and 2 cars and all that. And taxes were way higher back then, right?
Right. Yeah. So we know that it's possible. We just have to realize that the current system is disintegrating before our eyes. And just for us to realize we don't have to do this. We don't have to do this. We do not have to let profit be the main concern for providing healthcare. And right now, that's really what it is profit. First, I'm not denying the need for profit for business. It's a good thing. We need it. But in healthcare, it has no place. If you're talking values with people, I think that resonates across both sides of the aisle and all kinds of political perspectives. The values of freedom, pursuit of happiness, prosperity, security, those are pretty common values. And when we have a system like we have now with the medical industrial complex, those values are basically ignored so that the companies can make a profit. And if you were a CEO of the insurance company, you would probably do the same thing. Otherwise, you get fired or you might even get sued. So it's not that those people are bad. It's just that a for-profit system is in the wrong place when it's trying to provide healthcare. You can't do it and still maintain a profit. We, the people, can figure out how to do it. But me as a private hospital or insurance CEO cannot.
You mentioned that you don't think they're bad people. I think that's an interesting perspective because there's a lot of anger at people like health insurance CEOs right now. I mean, with how many people are denied care, how many people can't get treatment, how expensive everything is. I mean, they seem like the number one target, right, of people's anger. But you say that you don't think they're bad people.
No, I picture the CEO of United Health was a kid once, and he grew up and he wanted to succeed, and he took business courses and he got an MBA, and maybe he worked in some other industry for a while. And then there was an offer by a health insurance company, and he had all the skills, or she had all the skills needed to make that company work well and put those skills to use. And always that means avoiding risk. So if you're a CEO of an insurance company and you know you have to avoid risk in order to stay in business or to not get fired, you will do exactly what insurance companies do. And we call that cherry picking and lemon dropping. You don't market your business to people who are going to cost you money. Once they're in your plan, you're going to try to figure out ways that you don't have to spend money on them. And that's called prior authorizations, which are a tremendous headache to doctors. They know that person needs a CT scan. The criteria of Medicare and common sense says that they should get the CT scan, but United Health or Aetna says that's not in our guidelines. I'm sorry. This is not, we will not authorize this. That's painful. That's what's driving doctors to retire early, is to see that happening. It's called moral injury, actually. And it's kind of related to the same moral injury that soldiers face, having grown up in a family that values life and honesty and caring for others, and finds him or herself in the position of killing people who they know are innocent, and then having to live with that later. So doctors and nurses working for for-profit companies are faced with this dilemma of, I want to keep my job, but I can't approve this service for the patient that I know needs it. And science says it's justified, and even our laws say it's justified, but this insurance company says it's not. And that's moral injury.
So you mentioned cherry picking and lemon dropping. Can you explain a little more what that means in relation to healthcare?
Cherry picking means that if you're the CEO of an insurance company and your primary goal to keep your job and maybe not get sued is to avoid risk. Makes sense. And that's true of any business. So one way to avoid risk is to market only to those people who you're pretty sure are not going to cost you money. And so that means your seminar, where you want to attract customers, might be on the second floor of a building with no elevator. I think that's probably happened, but it's also a metaphor.
Meaning that, like, people with wheelchairs, for instance, couldn't get up there.
Yeah. But there are many other ways that fit that metaphor. For example, insurance companies they like to market to businesses because employees tend to be healthier. They're unlikely to go to market in a nursing home or in a poor part of a community or in certain zip codes. So that's cherry picking. The lemon dropping is a little bit just the opposite. For example, if I'm the CEO and the patient is already part of our healthcare insurance plan, and the doctor has ordered an MRI, I might think, I don't want to spend money on that patient, and here's my criteria for when an MRI is justified. And the doctor says it is, but our company says it's not, so we will deny that treatment. So if I'm the patient and I need that expensive drug or that procedure done, and it keeps getting denied, I'm likely to drop off of that plan. So it's dropping away from the plan, which is also called lemon dropping.
So yeah, and talk a little bit more about prior authorizations, because I feel like this is really key to a lot of the problems in the American health insurance system, but it's not necessarily obvious. So can you sort of lay out that problem a little more?
Well, I think it gets down to no plan, as desirable as it might be, can provide every service that every patient would want. So there has to be some form of rationing. In some countries like Great Britain, they have figured out a way to value certain services, and we have not done that. So we have not done well enough. Medicare has certain guidelines, what it will pay for. But if it's the privatized version of Medicare called Medicare Advantage, that's run by a private insurance company. And the private insurance company can have its own set of standards. And as you can imagine, those standards are geared to maintain the financial stability of the company. So they are likely to be much more stringent than what traditional Medicare's guidelines would be. And often that's to the disadvantage of the patient, and it's to the consternation of the doctor, who knows that this test is needed and that it would be approved by Medicare, but the private insurance company running the Medicare Advantage program is denying it, and that's what leads to moral injury. And I don't know if we mentioned that on a previous.
You talked about it. It's how it's healthcare providers experiencing that denial of care, seeing the consequences for their patients, basically.
And they know it's justified. They know it's justified. But the person they work for or the insurance plan that they're under denies it.
So we clearly have a lot of challenges in front of us to get to universal health care. So how do you think we get there?
Well, I think two ways. One is to realize that what we are doing now is unsustainable. The system is falling apart before our eyes. And if we fully realize that, we don't have to let it fully disintegrate. In Europe, it took World War II before the countries realized that they had to depend on themselves as in form of government to create adequate health care. There were no businesses left that could even claim to do it. We haven't reached that depth, but we're heading there. And if we can all be aware of it, we'll be more bold to take the needed steps, which is a major step to change from what we have now, which we consider normal but unsustainable, into a completely different system where all of the payment for healthcare comes through a central fund that we all pay into. That's a major change. We need to have it happen, but the public needs to understand it and approve it before it can happen. That's our job, is to let people know how bad it is now, if they don't know already. Give them hope that we can change it. Our DNA is not that much different from people in Canada and Europe and Japan and Taiwan and Australia and New Zealand that have good systems. We can do it. It's going to take sacrifice and it's going to take risk. And it's going to take confidence in government. And the only way we'll get confidence in government is to be government. That means traveling to Salem or our state capital. It means getting involved with local groups, whether it's the League of Women Voters or the Democratic Party or the Republican Party, and take all of this seriously, that we can't continue doing what we're doing.
Well, thanks for coming, Mike.
Yeah, you're welcome.
Good conversation, and I sincerely hope we get there.